Hi, I'm Simon Rushton, and this is Taxi Chronicles podcast. On this podcast, we spontaneously interview unsuspecting passengers with their permission, allowing them to share their intimate life stories and concerns. As our slogan states, real riders, real stories. Some riders prefer to be anonymous, while others ask me to tell their story later on. Either way, there are all genuine 5 to 10 minutes stories, so sit back and enjoy this episode. Morning. Yes, we're back again with another rider, another day. Today we've got Phil all the way from Sierra Leone, and his job is, you could say he's a specialist in HIV and AIDS, and we're just going to have an interesting conversation about, or he'll probably be enlightening us about statistics and precautions and all the other things to wipe away the stigma that or enlighten people, you could say, about this whole situation. So welcome, Phil.
Hi, thanks for having me.
Okay, that's good. So how did you get into this industry, and what motivates you to help people?
So I got into HIV prevention through, I met my now directors, Mark Thompson and Will Nutland, at Black Pride 3 years ago.
Okay.
And they were giving out condoms, which kind of were trying to, I guess, educate people about a drug called PrEP. Mm-hmm. So PrEP is a drug you take before and after sex that stops you from getting HIV. Mm-hmm. And I was quite knowledgeable about it, but I knew that there were a lot of people, a lot of like gay men as well, especially, that didn't know that it existed. Mm-hmm. And my kind of narrative was that if it works, why don't we have it? Or why don't people know about this? This is really important. So they were giving out condoms, and they invited me to a film screening. And when I went to that, I saw a documentary that they made on PrEP and PrEP access and how it is different in different countries. And from there, I ended up going on to do a campaign on testing for HIV and STIs, and then from there it just kind of grew and grew. And now here we are 3 years later, I'm working with them.
Okay. You say they don't know much about it. Isn't all that kind of medicine and stuff free here?
So I meant at the time. So in 2017, the knowledge on PrEP was a lot different to how it is now. At the moment, the tech, it's a weird one actually at the moment, because NHS has approved for us to have the service, and it's available. If you're in London, it's available at Dean Street. You can go there and ask to get onto the service, and you get straight on it. But we're having a lot of issues with local authorities, and there's just a lot of people involved, which is stopping the access to it. There was a thing called the PrEP Impact Trial, which allowed 26,000 people to be on it for up to 3 years. But now that trial's come to an end, we really need like a national service, and now we have it. We need to get everyone involved to get on it.
Why would they not want it?
Well, you have to think about who does HIV affect. So it's gay and bi men, Black African men and women, trans men and women, migrants, and sex workers. So those are people that are groups of people that are not typically like at the top of the chain when it comes to health or healthcare. So therefore, like the government, like other people involved, are not really going to put them at the forefront of their needs.
Okay, so in essence, instead of spending money on those pills, which is for, let's say, a luxury purpose, they'd rather spend money on children or something like that. They look at it like that. They're scaling it up.
Well, I wouldn't say it's necessarily a luxury, because it actually works out cheaper to give someone PrEP than it does to treat someone for HIV for their lifetime. So it works out in the NHS's benefit as well.
But isn't PrEP just for if you want to have intercourse? So if you want to have, and I'm just trying to understand it, so I did hear about this when I was in Kenya. Yep. But if you want to have sex, then it's to stop transmissions of the HIV. Is that correct?
Yeah, but anyone can take it.
Yeah, okay, yeah, anyone can take it. We're not talking about sexuality, we're just talking about what the purpose is it for.
So,
if you don't have sex, you don't need to take the pill. That pill or injection or whatever it is. Is that correct?
It's a pill, but yeah, I guess so.
So,
but I guess it can also be used. For example, in Scotland, there's a lot of drug use, and I forgot the word, but there's a lot of drug use with
the needles.
Yeah, needles, and PrEP has been used there, and it's been really successful there actually.
Okay. Yeah. So what I'm getting at here is, and I'm just trying to understand from the government's point of view, is that everything we're speaking on is not. People don't have to do it. So,
no one is forcing anyone to
no, not to take it, but to. If you know, for instance, if I know I've got a something that's a sickness or something that I can't, that is detriment to other people, I just say, okay, I'm going to quarantine myself. So I'm not, let's say in this case, I'm not going to have sex because I'm going to hurt somebody else. Now, if there's a pill, which is all great and very well, but now if I turn to the government and say, well, I want you to pay for this pill, the government's going to say, well, to what end? And your argument, correct me if I'm wrong, is to say, well, I will transmit it to somebody else. And then the government will turn around and say, well, then don't transmit it to somebody else in this nature. Do you understand? It's not like you're giving them a pill to enable them to deal with to stop the what do you call it, where your body's immune system's going down. It's not a pill to prop up your immune system. It's a pill just to enable you to have pleasure with somebody else and not contaminate them. Do you see what I mean?
But the argument is flawed because you earlier said prevention is better than cure.
Yep.
So NHS is happy to provide drugs that if you are living with HIV that stop you from passing on the virus and that stop you from that allow you to have sex and not be able to pass it on, or that allow you to live for as long as anyone else, but they do not provide a drug that allows you to prevent that.
Okay.
So that doesn't make sense to me. It doesn't make sense that we provide drugs to stop people that people who are living with HIV to not give other people HIV, but we don't stop people that are HIV negative to continue to be HIV negative.
Yeah, I see what you're saying. I'm trying to understand it from both points of view because I don't really know about all this PrEP thing and things like that. The only thing I was looking at is that you don't need, if you don't do an act, then you're okay. It's not a so I'm losing my words here. It's not, you don't have to have sex. That's what I'm saying.
But
sex is something that we do because we want to express our emotions to somebody else to a certain extent in that respect. If it's a pill for contraception to stop like having children, which can be a burden on the government, that's different. If it's a pill to stop, your health deteriorating, that's different. And that's how I'm trying to understand that the government may be looking at it like that. Now also it depends on the cost. If the cost of the pill doesn't cost that much, then I'd say, well, just give it out. It makes life easier. But then I also say this: those people who have the unhealth and who know about it should inform their partner. Do you understand? So people can take the full precautions to the extent. Because I know from my time in Kenya, there's people out there who will happily sleep with other people, purposely trying to spread it because they're bitter that they have it.
I don't think that's the case for everyone.
No, I'm not. No, of course not for everyone. I said there's some people, I've known that.
But also, I think you have to consider the fact that it's not a burden on the government because it works out cheaper, so we should have it. And also, I'm trying to remember what you said at the beginning.
Well, you're a good listener.
No, because I made like 3 points in my head, but I can't remember them all. But essentially, like it actually works out for the government and it works out for the NHS.
Yeah. So
it doesn't make sense to why we don't have it. Oh, I remember now. Sex isn't always about recreation. Sometimes sex is about pleasure.
No, I don't dispute that, and
not even just in queer relationships, but some heterosexual relationships. It's about pleasure. It's about going out and pulling a girl or doing whatever.
Yeah,
But like the same way you mentioned the contraceptive pill.
Yeah.
When that first came out, it was the same sort of issues. Or this is going to allow women to do whatever they feel like doing, and they're going to be out of control and which is the same narratives that we're seeing in this. But that's not necessarily the case. It's about people taking care of their sexual health. And as for telling other people, in the sense of if people are on effective HIV medication and they're taking their pills daily, legally they're not inclined to tell anyone about their HIV status.
Even if they find a new partner.
If they're basically, the way it works is that when you take the drugs is that it reduces your it reduces the HIV in your blood to such low levels that it's called undetectable. And when the HIV is undetectable in your blood, that means you can't pass it on. So therefore, you don't necessarily have to tell anyone about your HIV status if you're not putting them at risk.
You have children?
No.
Right, you have a mum?
Yeah.
Would you feel, let's say your mum and dad aren't together, your mum's got a new partner, would you feel comfortable knowing that the new partner had that and didn't tell your mum?
If the person was living with HIV and taking their drugs every day to keep themselves healthy and my mum healthy, I'd be happy with that. Yeah, but I've slept with many people that have HIV, so it's not an issue for me.
Okay, I don't want to go too personal on your own.
I'm just saying, it's not an issue for me, that's all.
Okay, fair enough, well, you're a thing.
I'm taking care of...
we're all different in that respect, in that kind of thing. So how... Does it look like the government's going to approve this PrEP?
Basically, the government has approved it. They've removed £5 million from the budget due to the coronavirus. I think they had a total of 16 million, if I'm correct.
Really?
Yeah.
16 million for this whole thing?
Yeah.
Hey, that's a lot of money, man.
Well, it's been in the pipeline for the last 5 years. There's a lot of advocacy.
Okay. Is that
there's a demand for it. There was almost 26,000 people on the PrEP impact trial taking it daily, and that wasn't all gay men. There was like over 800 trans and cis women that were taking it as well.
Okay.
You have to think about black African women that can get it.
I'm not here to focus on the race. How many people have HIV in the United Kingdom? Do you know?
I'm not sure. I believe it's. Off the top of my head, I think it's around 100,000, but I can't remember. I don't know the exact numbers.
It's not that many then, in comparison to. Okay, 16 million. That means those pills must be quite expensive then.
Initially, they were quite expensive because there was a patent on them, but you can actually get generic. You can get generic versions of the drug. So you see how when you go to, like, so if you get paracetamol from your GP, it's like the branded drug, and it's a lot more expensive. Whereas if you was to get it from Tesco, it'd be exactly the same thing, but it would cost you like 1/5 of the price, and therefore it actually works out cheaper because now it's actually basically that's what's available.
Okay. All right, that's good. Well, it looks like you've got all base covered.
I've been doing this for a little while now.
Yeah, and stuff. So, what would be your... Do you see yourself going into another career?
No. I want to do a master's in public health, and then I also want to. I want to do a PhD in public health, and eventually I want to open up my own kind of mental health and sexual health clinic. Which,
mental health as well?
Yeah, mental. I think it's along that. So, for example, the other day, I got tested. I funnily enough, this week I got some 3 months worth of PrEP. I got tested for STIs and HIV, and then I came back home, and then I had the therapy session on Zoom. So, I've always thought that if you have like good mental health, you have good sexual health. Whereas if you have bad mental health, you might make choices that you don't necessarily want or necessarily agree with. So I feel like it would be an incredible thing to have mental and sexual health services in the same place. Yeah, I was right. It's 101,600 people living with HIV in the UK.
100. So And then is it a younger? Do we know the age group? Is it like a young age group, old age group?
There's all different, because there's long-time survivors from the 80s and the 90s.
Oh, yeah.
There's people that were born with HIV because their mothers had it.
Yeah.
There's people that are getting it now that are in their 20s, in their 30s. So it's a range of different people. HIV doesn't discriminate.
Yeah. My catering teacher in school had it, and I was in the 80s, but he died.
Yeah.
And we didn't know. We weren't told until like after he died, because we kept on thinking, why he's not here? He's not here to teach us. Not here to teach us. He's called Mr. Was he called Mr. Day or Mr. Gay? I can't remember. It's something like that. And eventually, but he was really happy-go-lucky. But now I think of it, I can see, he was batting for his home team in that respect from some of the behaviour he did. But yeah, he was it was interesting when I think back now. It was interesting and things. So how long have you lived in this country then?
No, I was born here. I was born in Whitechapel. I'm from Sierra Leone, but I was born in Whitechapel. I was born and raised in East London.
Okay.
Yeah.
All right. Okay. Well, thanks for that interview. It's very informative, and hope all goes well for you.
Thank you for having me.
We hoped you liked that episode. Keeping in mind, we never know who we're going to interview. We post twice a day, 8 a.m. and 5 p.m. GMT. Have you ever considered the future economies to invest in? Why not listen to our sister podcast, Africa Investor Stories? Considering Africa has the fastest growing economies and population on Earth, and has done for many years, it holds 30% of the world's known natural resources. We publish twice a week, Tuesday with a guest investor, and Fridays talking about investment, politics and history, providing a clear understanding for any potential investor.